Hello, this is Dr. Shamima Sattar from the YouTube channel DrToHelp. Thank you for joining me today. Don't forget to like and subscribe if you like this video and share it with anybody who has UTI. Yes, we are going to talk about UTI. What is UTI? It's urinary tract infection. Who gets it? Obviously, women get it more. Almost 25 to 50% of my daily visits are UTI. So it is very important that we address it. In 2020 alone, the healthcare cost for UTI was more than $1.6 billion. That's staggering. So let's see if we can prevent it and treat it properly. All right, so we don't have any long-term complications either. All right, so who gets UTI? Obviously, women does. Can men get it? Can children get it? And babies? Yes, anyone in any sex, any age can get UTI. But who are more prone to it? Women, because of their anatomy, because our urethra is more close to the anus and thus contamination is easy. Also, at a certain age, like menopausal, postmenopausal, when the estrogen level is low, when the estrogen level is high, can also cause UTI such as ovulation and pregnancy. Urinary incontinence, older age when there is decreased mobility, and lastly, structural abnormality like bladder polyps, prostate enlargement. Those cases, in the last three cases, urinary incontinence, polyps, and prostate enlargement, please see your urologist at least one time so you have a workup done and see if there's something you can do to prevent future infection. All right, so how can we prevent urinary tract infection? A study of 140 people showed one group was told that they need to increase their fluid intake up to 2 to 3 liters a day. They used to take about 1.5 liter a day. When that was done, it was seen about 50% of those people cleared their urinary tract infection and prevented in future by 50%. So it's very important that we take plenty of fluids, 2 to 3 liters a day. All right. 2, please empty your bladder all the way. Do not leave any stagnant urine so the bacteria can grow. It becomes the media for them to grow, right? We don't want that. 3, please empty your bladder before and after sex. 4, take showers, not bath. When you do a lot of bath in the tub, you can get Pseudomonas UTI. You don't want that. And lastly, potty training trick, clean front before you go back. So when you're cleaning your urethral area, that whole perianal area, make sure you clean it properly and then go to your anal area so that you don't have any cross-contamination. All right, so those are the tips for prevention. What testing should you do about UTI? You start having symptoms. What are the symptoms for UTI? Burning, frequency, urgency, lower pelvic discomfort, cramps, low-grade fever, body aches. You can even have nausea. Some people even have vomiting. You can have change in color. You can see blood or pus in your urine. Those will be the signs for urinary tract infection. And if you start having these symptoms, you want to increase your fluid intake, right? Some people take AZO for symptomatic relief. You should not take it more than 2 to 3 days. Why? It can make your urine go orange. That's scary. 2, it can interfere with the test that your doctor might order. 3, if you take it long term, it can cause red blood cell hemolysis, and that can also cause kidney failure. So you don't want to do that. And 5, it can mask symptoms. So you may think, okay, it's gone, and then you may not treat it, and then it becomes complicated. So you don't want to do that. All right. If you have frequent urinary tract infection, you should all have urine dipstick test at home. You can go to Amazon and buy it. It's about 50 test strips. You can get it for around $10. I'm going to leave a link for you so that you can do it. 2, you can also take the cranberry juice. Yeah. Does cranberry juice treat UTI? No, it doesn't. AZO cranberry juice does not prevent UTI. It can help somewhat, but there's no significant evidence that was shown in any studies that were done. So if you are going to take cranberry juice, remember it's full of sugar. You don't want to give sugar medium for the bacteria to grow, so you don't want to do that. If you have to take it, you can take cranberry concentrate, and you can also take the tablet form. What you want to check on that label, if it contains proanthocyanidins, and it should be in 36 milligram. I'm going to leave a link for that as well for Amazon. Now, when should you start antibiotic? If you took all those home remedies and it didn't help you, after 2 to 3 days you're still having symptoms, please contact your doctor. I would prefer you to talk to your doctor first. If your doctor is not available, you can call us on telemedicine and we will help you. All right? We want to know the first time we may do it without doing any testing. We just want, if you have a urine dipstick and you test it, that would be great. I really appreciate people who do that and call me, because that is a confirmation that I am treating UTI and not something else, right? So if your urine dipstick was positive, you came to me, you did an antibiotic course. Usually an uncomplicated UTI is treated in 3 to 5 days. You don't need longer than that. So if you took a treatment a week or 2, 3 later, you call me back and you say, doctor, I need another antibiotic because my symptoms are back again. I'm not going to order another antibiotic right now. I'm going to order a urine culture. Why? Urine culture is very important. We will take that urine specimen, we will grow it in our lab, and we'll add antibiotics to it, different types, to see what bacteria is growing and which antibiotic is killing it. It's very important for us to decide which antibiotic to give you next. And please do not do inappropriate antibiotic use. I have so many patients who call me and tell me, oh, my mother had this antibiotic she didn't finish it. There was 2 left. I took it. It helped me a little bit. Now it's back again. When you do that thing, you know what you're doing? That bacteria is just getting a little bit weaker when you do that. And then when you stop the antibiotic, that bacteria gets smart. He starts thinking, okay, this antibiotic is killing me in this way. Let me do some genetic mutation so that they cannot touch me anymore. So next time you use that good antibiotic, it's not going to work anymore. So next time you will need to get a stronger, more complicated, and more expensive antibiotic each time. So please don't do that. Let us do our job. For you, just do your fluid. If you do 2 to 3 liters of fluid, 40 to 50% of the UTI will be resolved on its own. If after 2 days you're still having symptoms, call me. I will take care of you. All right? Call any doctors. They will take care of you. All right? So what can you do to prevent UTI? Fluid. 2 to 3 liters a day. 2, empty your bladder as much as possible all the way, so you don't leave any medium for the bacteria to grow. 3, empty your bladder and clean yourself front to back. Potty training trick, you need to clean front first, then go to the back and do not come back forward again. 4, take shower and not bath. Bathtubs can give you Pseudomonas UTI, so you want to do showers more than anything else. All right? And go to the bathroom whenever you have the urge. Do not hold your urine. I know us healthcare providers, nurses, doctors, we don't stop. Truck drivers, they don't stop. They're always going. You need to stop and take care of your urge. You need to go to the bathroom, please go to the bathroom. I even tell my nurses, please put an alarm on your phone to remind you to go to the bathroom, because they get so absorbed in work that they forget to even go to the bathroom. I did the same when I worked in the hospital. So yes, we need to take care of ourselves, right? So fluid, empty your bladder, clean properly, take showers, not bath, and empty your bladder when you have the urge as soon as possible. All right, that's all I'm going to talk about today. It was very nice meeting you again. Thank you for watching my video. Please do not forget to like and subscribe and share it with everybody who has UTI. I know it's very common. If it was helpful for you, it will be helpful for others. And we want to help as many people as we can. I love you all. I missed you. I will try to work this summer and do videos every week. I promise. Take care. Love you all. Bye-bye.